When you hear the words trauma-informed care, you may think it refers to just injuries, but there is so much more that it covers. Since October is Domestic Violence Awareness Month, it's worth shining a new light on this often hidden issue. Here today to talk more about trauma-informed care and resources available through Mount Carmel is Melisa Minier, a forensic nurse manager. We are so grateful that you are here, Melisa.
Thank you for having me.
People will likely be shocked by the statistics. Can you tell us a little bit about how common domestic violence is right here in our own communities?
Absolutely. Most people would think that this is a rare occurrence, but actually it's 25% of women and 1 in 5 men will have experienced severe physical violence from a partner within their lifetime. Columbus Police actually released statistics for 2024, and that was that 19% of their homicides were related specifically to domestic violence. So that's a 17% increase from the year prior, whereas we only saw 5% coming from 2022. So we can see that it crosses demographics and it's definitely on the rise.
That is shocking to hear.
It is.
And surprises a lot of folks. What role does what you do as a forensic nurse play in supporting victims of domestic violence?
We provide first of all, we see patients in both short and long-term healthcare consequences related to all forms of victimization. So what we do is we tailor a very comprehensive exam to each patient. We focus on safety, we focus on privacy. We want to make sure that the resources that they're being provided, that they feel like are created for them so that they're more likely to use those. In addition to that, we have almost 30 nurses that are forensically trained within our system. So Mount Carmel saw the need and then really responded within the healthcare system. We provide that exam and then we make sure that we facilitate their care. We feel like if we prioritize the patient and focus on safety and privacy and empowerment, that this will definitely lead to a more successful pathway to safety and security and ultimately healing.
I can only imagine the types of injuries that you come across, probably ones that you can see and ones that you cannot see. What types of health risks do victims of domestic violence face? Once they come, when they get to you, what do you see that they have gone through and are suffering through?
I feel like the important part of an assessment is not only to look at what injuries you see outside, but also what's happening on the inside. With domestic violence, one of the things that is very prevalent, actually 30% or more, is strangulation. And so with strangulation, it is, we understand the importance of that assessment, both internally, what's happening to that patient, and explaining to them, this is what's happening with your body. 50% of the time, you're not going to see any external signs. Such a small amount of pressure is actually going to have catastrophic damage internally. This can be post-traumatic stress disorder. This can be traumatic brain injury. It can lead to stroke, along with a host of other healthcare complications across the lifespan of this patient. So really, we need to make sure that we are focused on that. One of the efforts that I do love that we focused on as a city, Columbus Police Department STOP team. So they specifically respond in the field to victims of violence. They respond with an officer, they respond with an advocate, and so Mount Carmel Forensics was able to go in, participate as part of this training that was widely supported by City Attorney Zach Klein's office, the Columbus Police Department, as well as the Prosecutor's Office for Franklin County. And so what's been amazing about that is been able to teach these officers that respond, what are they looking for? What do they need to talk to people about? Because sometimes they just don't know. They've been going through this for so long, and forensic nursing understands the dynamic and how hard it is for them to come into the hospital system. So we want to encourage that and for them to understand that they should seek medical care.
What words do you have for somebody who is maybe reluctant to leave a dangerous situation?
It's understandable. It is a highly volatile situation. We understand that it's difficult to leave, and statistically, you're going to try to leave 7 times before you're actually successful. One of the things that we pride ourselves in is doing a safety plan, making sure that you're ready, you're prepared. And if you're not ready to leave right now, that's okay. Let's talk about your options so that you can make what decisions are right for you.
Speaking of options, what resources are available to victims right now?
Yes, that's the most important. So obviously forensic nursing across the state, see a forensic nurse. We understand the dynamics. In addition to that is the Ohio Domestic Violence Network. Also choices. So this is Columbus's only domestic violence shelter. A lot of times people shy away from shelters, but they actually have in 200 different languages. They've got legal help, counseling. They've got all sorts of services for both you and your family to help keep you safe and help you move on with this successfully in your life, feeling like this doesn't have to define you.
If nothing else, people should know there is help available, right?
Absolutely.
All right, for folks watching right now, where can they reach out for more information?
They can actually go straight to Mount Carmel's website. In addition to that, like I mentioned, Ohio Domestic Violence Network, and as well as Choices.
Melisa, thank you for all the work you do for domestic violence victims.
Thank you so much for having me.